Go to the next session, which is Urology Industry Relationship, how to make most out of it. May I welcome on the stage the moderator for the session, Mr. Dr. Kanda Parikh, Mr. Fani Kumar from Cipla, Mr. Naveen Hazari from Biorad, and Mr. Dinesh Singh from Intas.
Good afternoon, and thank you, Dr. Sabnis and Dr. Abhijit, for giving me a topic where I don't have to prepare any presentation. So it's going to be kind of a conducting an exam with the trade, and as we know, the relationship between the trade and the medical fraternity is like the relationship of a husband and wife. So they are the two sides of the same coin, and all of us are sailing in the same boat. So the mutual respect and responsibility, I think, will sail our boat smoothly. And so this is going to kind of an exam for you guys. So I am an examiner, and you are three high-profile people. One, Mr. Fani Kumar from Cipla. You can see your picture there, Fani Kumar. Then we have Mr. Dinesh Singh from Intas, and Mr. Naveen Hazari from Biorad. It's me who will be asking some questions, and I think I'll keep the session short. So if you have any questions, you can discuss with them directly, because it is very, very important, and most of the points are covered by my friend Dr. Vijay Oza. So we'll not cover those aspects, okay? Here we want to understand how industry can support the doctors. That is what is our intention, other than sponsoring for the conference. So, some newcomer who is starting to practice, or somebody who is very much competitive in his practice, and he wants to organize a free camp. Can we have a free camp support, and what way company can support? I'm starting with Mr. Fani Kumar, and we'll keep the answers also very short, okay? Please.
Sir, what I give my views, it will be purely on my personal views. Just a note, it's a kind of disclosure, not representing any company at this point of time. When it comes to free camps, when you talk about screening camps, I suppose, sir, whatever the things which any pharmaceutical company offers to the HCPs is purely under the guidelines of UCPMP. That was the thing, and free camps has been very much allowed, and it can be done. Especially free camps when you say initial advertisement, paper pamphlet, and PSA and Euroflowmetrics is very much allowed, which we can do. And the executives local, they help you in identifying the surrounding villages where they can do that. And initially, doing the camps is the best time tested method for any young budding urologist starting camps. So very much is allowed.
But so how does a company support? Like, you spend money for whatever is the expense which is incurred by the concerned doctor or the hospital?
Pharmaceutical companies are entitled to spend money on advertising expenses, because objective of this is patient diagnosis and awareness. As long as any expenses comes under patient awareness and diagnosis, any header, it can be, patient pamphlet or radio advertisement or, television advertisement, scrolling or flexes, it is very much allowed. Yes, it is any expense for he staying for his car, it is not allowed.
So, supposing if you are conducting the camp outside, supposing if I am conducting camp outside Ahmedabad.
Yes.
So, you will not take care of the...
I won't take care of your logistics. Definitely, I can take care of the patient awareness initiative, which comes under the PSA coupons, Euroflowmetric machine carry करने के लिए van, उसका operate करने के लिए technicians. All those things can be taken by pharmaceutical.
You will be paying this money directly to the vendors?
Yes,
or you will supply
we will be directly paying to the vendor.
Money to the hospital?
Directly paying to the vendors.
So, you will not go through the hospital?
No. Because we have been entitled. Because as per the, UCP code of conduct, I can do any patient awareness initiative. It is a due responsibility of any pharmaceutical companies also create an awareness about the disease. So I've been entitled to that. So we can do directly.
Dinesh, do you have any extra comment to make on this? Any other point you want to raise?
See, such camps are possible. Logistically, sir, there are two factors. One, creating awareness among patient, whatever cost is there, is under the compliance of UCPMP. Which is going to the individual is prohibited, including the test, because then it is for the patient. Whether it is through the doctor or directly, those are under a
So your company
possible.
can pay to the hospital, and then you can channelize the money to the vendors.
Sir, these vendors are pre-approved and they are being communicated. This is the location where you have to go and conduct the free camp for those patients to alleviate their suffering, and the attending doctor will give the prescriptions. There is no direct affiliation between the doctor or the clinician who is going and the patient and the company.
So this
That
is-
connection should not be
so this is
attached.
more or less applicable to the pharma company.
Yeah.
But does it really differ for the industries, like the instrument manufacturer? How do you support? Do you support this camp? And if you at all support, then how do you support?
Um, Yes, we do support the camps. We join hands with the pharma companies also, and then we conduct the CMEs. But as a urology manufacturer device company, so we come up with innovative and reliable products. So now all of you have the new products in your mind. So if you have any ideas, we can always develop that products which can be more reliable.
Okay, so I think that regarding camp, the more or less the doubts are clear. Anybody else has a question to ask to the company? We'll finish in time, no problem. But anybody has a question regarding the camp? How do you, yeah, please, sir.
So we heard that from that camp there was a brochure to doctors. So we will pay for that brochure. Thinking of
I won't pay, sir. We won't pay that. Sure.
it needs to be the
Yes, that can be arranged by the respective hospital. I'll take care of all the diagnostics. I can again be initiating. We can take care of all the publicity and advertisements for regarding the awareness about the free camp and free diet.
So publicity done by the hospital, not by the individual doctor. That's what you want to ask. Like, so that there can be the name of the hospital, like my hospital is Shyam Hospital. So Shyam Specialty Hospital organizes this camp. But it cannot be under the banner of Dr. Kandar Parikh or Aditya Parikh. Is that correct? Yes. Yes. So I think that doubt is clear. Now you want to do advertisement, because we so many times we listen to the advertisement on the print media or maybe the television and the webinars, and sometimes in the local radio. So how do you support that? Because I have heard many advertisement on the supported by X company, Y company. So how do you support that?
Sir, again, when it comes to the UCPMP guidelines, any talks, discussions, deliberations under the patient awareness is very much allowed. But there should be clear-cut disclaimer what is the objective and what is the expectation from the pharmaceutical company and what is the expectation from the doctor who is conducting that event. Ideally, as per the coded in UCPMP guidelines, while I'm doing while doing an awareness initiative, either TV or a radio or a paper, there should be clear-cut disclaimer that there should not be any commercial viability. It is purely an objective of the patient awareness initiative.
No, but that
And there should not be any company name or brand name as such. But still you can see a lot of websites and all those things. But ideally, as per the UCP code clearly mentioned, there will not be any brand attached to that.
The brand is okay, but I think so many times we, supposing there is I think right now there is one TV commercial going on,
Yeah.
support, that talks about the doctors, the doctors are gods and this and that, and then supported by the Mankind pharmaceutical company. I saw that visual many times. It's a lovely advertisement, but you say that there cannot be company name, so is it possible?
Sir, even you cannot put the company name, you cannot keep the doctor's name. Yes, either you can keep it only one. If Dr. Kandar Parikh is conducting a Red FM interview for the patient awareness, it is very much allowed where Dr. Kandar Parikh is doing. If any X company is doing, they can put their name. Both cannot be there. It is a conflict of interest because.
But the Kandar Parikh is doing, but company will pay for that, right? Is it correct?
Yes. Yes.
Yes.
If
It has
you
got
have got any contradictory view also, please share, so
Correct,
that
sir.
we understand it.
As you referred, sir, the Mankind, the initiative is not for a doctor. It's a group of doctors where rather than going to the GPs or unqualified lot, it's better to go to the qualified medical practitioners. And the initiative from Mankind, it is very much approved under UCPMP, wherein a name of a doctor or a hospital is getting to be advertised either orally or visual or with a hoarding is prohibited. Now the third factor is there. In such cases, company can join hand with that. So a specific disease epidemiology or a treatment therapy or group of identification can be done. That this hospital,
Many advertisements like focusing on the cervical cancer or a breast cancer, where group of doctors, one or two doctors are giving interview, and it is supported by some pharma company. So is it all okay?
yeah, it is there because sir, it is something like they say na sir, Ashtadas Puranesu Vyastasya Bachanam Duyam Paropakara Punyaya Papaya Paripidanam. Government is working under this that if your objective is holistic, is good. But if it is for money making or extracting some population for commercial gain, is prohibited. So under that, what they have done, grants can be given, donations can be given under CSR. But if somebody wants on ticket, hotel, or for arranging such camps, is not approved.
Public, sir, any comments on this? No?
So after Mr. Dinesh, sir, like if
Yeah.
West Zone USA is doing the patient awareness initiative, like West Zone Urological Society of India has taken a cause that will create an awareness on UTI. Definitely, any pharma company can give a grant to the West Zone USA, not to the individuals.
Rohit, you wanted to answer?
Issue is public interest by India. Then that's accepted.
Accept.
So you get a lot of offer, such offers, so there is a lot of work.
Not at all
Anybody
problem.
in the audience has any question? Youngsters, fine. This is a session for you guys, I think.
Only one prohibition is there, sir, which one has to be very clear. Because under UCPMP, which is signed last year, 12th March 2024, it says that any medical samples should not be accepted if company is going to report against the doctor or the hospital. So this clarification should be taken in advance. Say for example, as per new UCPMP guideline, for 3 patients at a given time, the course can be taken and the repetition for 12 months is acceptable. If it is exceeding the numbers and the 3 units for 3 patients, then the value need to be calculated. It should be within 20,000 rupees, acceptable. If it crosses 20,000 rupees, corporates have to keep the stock, report on the internal website and deduct the TDS. The same need to be communicated to the doctor or the clinician or the hospital. They should also declare under the profit and the tax deduction should happen. Else, under income tax 1964 or the 2024, it should be punishable if they go for the inquiry, hiding the facts under profit.
All right. So now the conferences, whether the companies can sponsor doctors, travel, etc. I think it is well discussed, so we'll not go into it. But many people ask me that, sir, you are organizing this conference for many years. You are inviting 15 international faculty, 70 national faculty, big show. How do you generate money? Of course, I am getting it from the industry, and some amount comes from the registration. So we run the show without making any loss. No profit, but no loss. So my question to, I think, Navinji, first we will start with you.
Yes, sir.
Supposing when you are supporting this kind of a conference, what is your interest in supporting this conference?
So our main interest is that, as I told you, that we manufacture the devices. So we want the new devices to be showcased in the surgery so that it can help the doctors that what are the benefits and features of using these products.
So doctors as well as the company, of course.
As well as the company, definitely.
Yeah. So that is one. What other factors you look into when you want to participate in a conference? I mean, everybody is organizing a conference. There are many conferences happening every week. So how do you, what is company's perspective other than just the sale of the product or the advertising the product? But what is the interest of the pharma company in the industry? And how do you decide that this conference, I will sell out this much of money. This conference, I am going to give less money or I am not going to participate. What is
Right,
how
sir.
do you decide?
Couple of minutes back, 3 models of hospitals were discussed. Finally is a revenue and expanding the wealth through our expertise. In companies also, sir, what we do at Intas is character, consistency and credentials. So wherever we started, when UCPMP was not there, our NMC has liberal view for that. So under publication of our product and advertisement, we give this money. There is no other route left for financial benefit. Heart to heart is that those who are attending, they are upscaling their credentials and they are going to be a better surgeon, a better institution for the society. Is that in the mind, sir?
So when it comes to any conferences, conference is a part of a neurological practice. Any company, whether it's a top company or top 100 company, they have a definite fund for any conference. Definitely, like the expectation from the conference, from the leaders like me or my executives is how can we engage or help upcoming urologists to get more knowledge enhanced. That is an objective. Now, when I look at the conferences, this year, a rough estimation is 287 conferences are coming. Now, where I took 287
Urology.
urology
Just
conferences.
listen to this.
287 conferences I have, but I have a limited budget. Now, if it comes to me, like someone asks me, Panikman, on what basis you have selected this conference? First thing is the relevant and forward-looking content. Today, people doesn't, days are gone, people come for conference for other purpose. They want to have a related content and really forward-looking because ChatGPT is there, they get anything on a fingerprint. They would like to understand what is the latest in the kind of area, whether it's endourology or, whatever the area which is. Second thing is it should be a workshop model. They are not comfortable or we shall be not comfortable for a theory sessions or long panel discussions. Third thing is the faculty strong. Means what kind of faculty is there in this going to conference? It's a national faculty or international faculty, but what is the credibility of the faculty? And sir, surprised to that actually many pharma companies, I think both of my colleagues votes for that. We look at the credibility of the organizer also, in terms of his capability in making the event successful in terms of academic. Last but not least, sir, how compliance with the industry partnership we have. These are 5 things makes difference in.
Any other points you would like to add? Naveen ji, aapko bhi agar
The
kuch-
factor is same. I'll hand it over to him. One is deciding the budget, and second is consequences post conferences. So the places, those who are not having credibility, they are having lot of fragility, because whatever they did, they do not follow the compliance part. As you said that we are identifying that upscaling of skills should happen. Industry has nothing to do or to suggest somebody what agenda should be there. Whether you keep a surgical process or a theory, this all is the domain of the conferences. Because nobody can suggest you do this and we are partnering this. It is a silent one.
Okay.
So heart to heart is there, but on paper nothing is there.
Alright. Naveen ji, any point you would like to add other than this?
Other than this, I would like to say that the scientific program decided by the organizers, that has to be very interesting. So that is what attracts the urologist to attend, that there is something new to learn.
Okay, so if I summarize, every company has a specific budget for the, whether it's a state conference, is a national conference or a city conference. So I think they have a different budget. That is one. Scientific content, most of the points you covered is very well. I made it myself. But scientific content and the faculty are very, very critical and important for the company to decide. So when you want to organize a meeting, please keep these things in your mind. Number of delegates, I think, kitna number aayega, sir. Uske hisab se hi they are shelling out the money. I think that is also very, very important. Credibility of organizer. If organizer is good and he is giving a good academic content, company will be more than willing to spend money. Relationship, ultimately it boils down to the business. Sometimes, so how much business X company or Y company is getting from the organizer or the zone, I think that is also one consideration. And finally, cost involved. If you are asking for too much of money for any conference, probably they will back out. So I think we will close this because we have to stick to the time. And thank you very much. I hope, and thank you all panelists. Thank you. And thank you everyone.
Thank you, sir, and I would thank all the industry people who had actually gone out of the way to understand and answer all the questions. Because sometimes we have to understand the other side of the coin also.